Assalamu alaikum wa rahmatullahi wa barakatuhu. I'm Ms. Ulfat Amin, PG Pediatric Nursing, Diploma in Nursing Administration. Today I'm with part second of the previous video, that is nursing theories. Contents I will be discussing today are importance of nursing theories, characteristics of theories, classification of theories, and conceptual framework. First of all, we will discuss importance of nursing theories. As I have already discussed in my previous video, a theory is a set of concepts that may be empirical concepts, inferential concepts, or abstract concepts that provide an overview of phenomena, or we can say that describe a pattern of reality of the phenomena. So the first importance of this nursing theory is it helps us to decide what we know and what we need to know. So we can say nursing theory provides a perspective from which to define what of the nursing, to describe who of the nursing, and when the nursing is needed. Like we need to know in future, or we need to know what we need in the future. Help us to distinguish what we should form on the basis of the practice by explicitly describing nursing. Nursing theories assist nurses, or we can say assist nursing discipline in clarifying different kinds of beliefs, values, and goals, and helps to define unique contribution of nursing in caring the clients or giving a better nursing care. Help us to maintain professional boundaries. These nursing theories helps us to identify boundaries and goals of nursing therapeutic activities. It provides a structure for communicating with other nurses and other health team members. So we can say this nursing theory helps the nurses to communicate within the nurses, or we can say with other nurses and with other health team members. Help us nurses to provide better patient care. This helps us to understand and find meaning from experiences, or we can say from past experiences, organize and articulate what we know, or what we are knowing, and ask questions leading to new insights or new knowledge. Provide us foundation for nursing practice and help us to generate further knowledge and indicate in which direction nursing should develop in future. This nursing theory, if we see, nursing is a unique healthcare discipline in which nurses provide services based on the knowledge and skill. So we can say this body of knowledge comes from various nursing theories, like we have Florence Nightingale's theory, Paplow's theory, Orem's theory, and provides us the rationale of the nursing intervention or the nursing care that we are giving to the patients, or we can say provides a foundation for nursing practice and gives us future directions for the nursing care. Enhances professional status of the nurses. When nurses explore various theories, what will happen? They will gain new insights into the patient care, or open new options otherwise hidden, and stimulate innovative interventions for a better patient care. This enhances and strengthens the nurse's role in the healthcare settings and helps nursing to grow as a well-developed profession. As medicine tries to make a move towards adopting a more multidisciplinary to healthcare. Nursing continues to strive to establish unique body of their knowledge. In broader sense, we can say nursing theory is necessary for continued development and evolution of the discipline of the nursing, because the world of the healthcare is changing, or we can say the world of healthcare changes virtually on daily basis. So nursing needs to continue to expand its body of knowledge or its knowledge base in order to proactively respond to the changes as per societal needs or as per the needs of the customers or clients. Characteristics of theories: these are interrelated concepts to create a different way of look at a particular phenomena. As we have already discussed, that it is interrelating of concepts in order to create a new idea or a new pattern of a phenomena. These theories are logical in nature, so we can say they form a logical pattern, or we can say reasonable pattern. Next is generalizable. So generalization means when a theory is developed and applied to a particular person or on a particular situation. तो अगर हमें लगता है कि इसके effects जो है they are good, then we apply it to a large population. That means this is generalized. For example, if we talk about the COVID-19 patients, जो quarantine है, it was applicable फर्स्ट जो है स्मॉल ग्रुप ऑफ पॉपुलेशन. तो जब लगा कि हाँ क्वारंटीन से कंट्रोल हो रहा है ये COVID-19, तो उसको जनरलाइज किया गया and then it was applied worldwide. It's composed of concepts and propositions, as already discussed, that it includes concepts and prepositions. Contribute to the body of knowledge, as we have already discussed that theory contributes to the body of knowledge, or we can say this theory provides a base of the knowledge to the nursing profession, and it's utilized by practitioners to guide and improve their practice. So different practitioners or different nurses use it in order to have a better guidance and in order to improve their now the classification of theories. First is the meta theory. A meta theory is a theory whose subject matter is some theory, or we can say a theory about another theory. As such, it may be called as a theory of theories. This theory focuses on broader issues that address the important, or we can say most important concepts and the relationship between among these concepts, like human beings, health, environment, and the nursing. For example, if we talk about the Orem's self-care deficit theory, this theory is made of three interconnected theories: the theory of self-care, the theory of self-care deficit, and the theory of nursing system. Next is the grand theories. Next is the grand theories. These are composed of concepts representing global and extremely complex phenomena. Typically, we can say a grand theory is not intended to provide guidance for the formation of specific nursing interventions. As we have said, that theories help us in the formation of the specific nursing interventions, but it rather provides an overall framework for structuring broad abstract ideas. Like if we talk about this grand theory, for example, Orem's self-care theory. The theme of this theory is self-care is a human need. As I have discussed self-care is a human need, and self-care deficit requires nursing action. So we can say a grand theory explains an abstract idea or a concept, not help us in framing the nursing interventions. Middle range theories. This theory addresses more concrete concepts and narrowly defined phenomena than grand theory. Description, explanations, and predictions in this theory are intended to answer questions about nursing phenomena, yet they do not cover the full range of phenomena. For example, if we talk about the mid-range theories, Pavlov's theory of interpersonal relations. This theory's theme is nursing is a therapeutic, interpersonal, and goal-oriented process. So we can say these middle range theories answer certain questions about the nursing phenomenon. Now the practice theory, or we can say micro range theories, most concrete and narrow in scope. These theory explores one particular situation found in nursing, such as the effect of social support on grieving, and establishes nursing care guidelines to address the problems. These kind of theories, we can say, have a more direct impact on nursing practice, and these theories are also known as perspective theories, or we can say micro range theories. Now the conceptual framework, it's a written or visual presentation that explains either graphically, or we can say in a graphic form or in a narrative form, the main things to be studied, like the key factors, or we can say the concepts that we have already discussed, that may be empirical concepts, inferential concepts, or abstract concepts, or variables, and the presumed relationship among these variables, or we can say among these concepts. Or we can say a conceptual framework is analogous to the frame of a house. Just as the foundation supports a house, or the foundation of a house tells us how strong this house is gonna be, or how big this house is gonna be. तो same way जो ये theoretical और conceptual framework जो है, it provides us rationale about the relationship among the different concepts, or we can say about the various variables, or we can simply say it's a basic or a supporting structure of any this theory or of a nursing process, or how these concepts in the nursing process work, or the way these concepts are organized in the nursing process or in a theory for better results or for a better patient care. Thank you. This was all about this presentation. See you in the next lecture.